afternoon, everyone. So the myth that I'm going to be addressing is the myth that in the general U.S. population, folate and B vitamin supplements decrease our risk of cardiovascular risk and mortality. So, sometimes when I talk to patients, they're hesitant to take certain medications, but are very keen to show me articles like these that, say B vitamins instead of taking statins, for example, may lower their risk instead. So I wanted to take a closer look at the history of this as well as the literature. So we'll be talking about B vitamins, reviewing some of the biochemistry, especially related to homocysteine, looking at statistics regarding cardiovascular disease risk in the US, as well as the supplement industry, and delving through the literature, looking at how and whether or not B vitamin supplementation does actually improve our outcomes. So some statistics for us. In 2019, the Global Burden of Disease study showed that 18.6 million people worldwide died from cardiovascular disease. In the US, that number was closer to 655,000, number one being CAD, two, stroke, third, hypertension, and fourth, heart failure. And actually, another statistic that I found interesting was that, according to the National Health and Nutrition Examination Survey, over half of the US population uses supplements, and the number one supplement is actually multivitamins. So 31% of people use multivitamins. This industry, I saw a lot of numbers, but it seemed to gross around 40 billion every year. And now we know that cardiovascular disease has many modifiable risk factors, and a lot of the times patients, want to address these risk factors by things that they can change: diet, exercise. And so do vitamins actually help treat and prevent disease? So some biochemistry review. Homocysteine is a sulfur-containing amino acid. It's an intermediate in the metabolism of methionine and cysteine, and it's associated positively with increased risk of cardiovascular disease, according to the AHA and American Stroke Association. I think hyperhomocystinemia is associated with over 2 times increased risk for atherosclerotic disease. And so deficiencies in B vitamins, folate, can lead to elevated homocysteine. I'll go into a closer biochem review on the next slide. And so the homocysteine hypothesis was actually first brought up in 1969 by a pathologist, Dr. McCulley, who looked at 2 kids with homocystinuria that ended up with severe atherosclerosis. And so that was first proposed back then. The correlation has been significant, and in 1976, this study that I read looked at a lot of the mechanisms, including endothelial impairment causing oxidative stress related to things like nitric oxide synthetase, as well as increased thrombogenicity as some of the mechanisms. So this is also interesting because in the 1990s, the US started fortifying a lot of the foods with folic acid to try to prevent neural tube defects. And actually starting that year, I think it was 1998, following that, we actually found that high homocysteine concentrations in the population decreased with the supplementation. So while the primary goal was to prevent neural tube defects, an unintended benefit of folic acid fortification was also the reduction of homocysteine levels, which is very interesting. And I just wanted to make a note, there's other reasons why people have high homocysteine levels. It increases often with age, CKD, certain medications, including antiepileptics, and genetic defects. But those were not very common from what I found. And so B vitamins are water soluble. There's 8 B vitamins that we won't go through in detail, but we'll be focusing more on 6, 9, and 12, which are involved in the metabolism of homocysteine. They're all absorbed in the jejunum except for B12, which is absorbed in the terminal ileum. So 6, 9, and 12 are involved in this 1-carbon metabolism cycle. Just to note, 2 or riboflavin helps convert folate to its active form. So if in the context of B12 deficiency, you see that the remethylation of homocysteine is affected. So starting on the left side, B12 is a cofactor for methionine synthase here. But the key point to remember here is that in B12 deficiency, you actually get an elevation in methylmalonic acid. So since it's involved on both sides, you see an elevation of MMA. Methylmalonyl-CoA will build up and become hydrolyzed to MMA. So in that key board question of like B9 and B12 deficiency, you also see MMA elevation only in B12. So you also see that B6 is involved in another pathway, not methylation, but it's involved in the transsulfuration pathway. And so in this pathway, it uses two PLP-dependent enzymes, which aren't listed here, but they're called CBS and CSE. And reduced activity of these enzymes leads to accumulation of homocysteine as well. And as we know, B6 is also involved in heme biosynthesis, but we won't be going into that. So that's a review of the biochemistry. So I reviewed a lot of the early 2000 studies that were observational studies looking at inverse associations of cardiovascular disease and plasma concentrations of B6, B9. And this one study, this sulfone trial in 2010, also looked at omega-3 fatty acids. So ultimately, spoiler is, both of these studies showed decreased plasma homocysteine levels by 25% and 19%, which is pretty significant, but no eventual outcome on major cardiovascular disease. And both of these studies actually looked at people who had a history of vascular disease, including coronary, cerebrovascular, and peripheral vascular disease, with endpoints being cardiovascular death, MI, and stroke. Both of them were randomized with a placebo group and an active treatment group that was treated with folic acid, B6, and B12. In both of these studies, participants were followed for about 5 years, and they checked in every 6 months looking for those endpoint composites of outcomes. Of note, in the HOPE-2 trial, at that time it was the biggest trial at looking at trying to lower homocysteine as well as what it would do to cardiovascular outcomes. They did note a reduction in stroke in the group that was treated with B vitamins, but of note, they did further analyses that HOPE-2 involved a lot of countries that didn't supplement their diets with folic acid, and those effects were greater in those groups. And so this study was done in the Journal of Cardiology in 2021. It was a systematic review and meta-analysis of vitamins and mineral supplementation on cardiovascular disease and all-cause mortality. It was done between 2012 and 2020, including both randomized control and observational study data, with their main outcomes being major adverse cardiovascular events, including non-fatal MI, non-fatal stroke, total mortality, and stroke incidence. And overall, their findings did find that B vitamins may reduce the risk of stroke. And I wanted to point out in particular, 7 studies in a meta-analysis were showing reduction in stroke, but this was largely driven by one study in particular called the CSPPT. It was a study of 20,000 people, and you can see their total N here is 24,000. The CSPPT was the China Stroke Primary Prevention Trial, and so participants there were treated with 0.8 milligrams a day. They all had baseline hypertension, and it ended up reducing their stroke risk by almost 30%. And of note, like when analyzing this study, China is one of those countries that doesn't have folate fortification. So this, I think, study kind of was driven by that effect. And interestingly, the reduction of stroke within the CSPPT study was proportional to the reduction of total plasma homocysteine. And I also noticed in this study, those effects of reducing stroke were also higher in those with higher baseline LDLs, higher homocysteine over the level of 15 to begin with. And so I think the most important study that kind of guided my research was one that came out recently in February of 2024. It was a meta-analysis and systematic review of 14 RCTs of folic acid with B12 and B6 for stroke prevention, since that was the only kind of significant factor that I could find throughout my literature review. It had almost 80,000 participants with almost 3,000 stroke cases. The meta-analysis specifically broke down populations with or without grain fortification using databases like the Global Fortification Data Exchange to classify countries based on fortification status. A lot of times in these studies, they didn't note people's baseline B vitamin levels to begin with, and they kind of used fortification or not as like a measure. And so most notably in this one, I'll point out here, in this forest plot, it shows the relative risk of stroke with combined B vitamin supplementation across these different studies. But in the bottom here, you see, let's see, 1, 2. So in populations in regions that don't fortify their grains, it did reduce their risk of stroke by 34% on the bottom arrow. In areas that had partial grain fortification, it did reduce the risk of stroke by 11%. And in places that did fortify their grains on the top arrow, there was no significance in reduction of stroke. And so to me, using this study, it doesn't translate to reduced risk, even though supplementing with B vitamins does lower people's homocysteine levels, especially in places like the US that do have fortified grains. And so even after like 20-something years of supplementation, I couldn't find any studies in the US that have shown benefit in adding additional B vitamin supplementation to our diets. You know, many studies suggested improving our diets to begin with as ways of risk reduction, but I personally couldn't find anything through supplementation alone.
Okay, anybody have any questions or comments about that?
He said, is B12 and folate deficiency a marker of poor diet?
Yeah.
I don't think necessarily so, but I think to like clarify my point, I think in the general population that does not have deficiency to begin with, that's kind of the myth I was trying to address. Sorry, I didn't really get your question.
Certainly there are conditions, you know, like B12 deficiency that's not necessarily due to diet, it's due to the absorption problem. But I think they were using...
people who baseline didn't have the deficiencies.
Most of these studies were population or large numbers of patients. The larger studies were done in like large numbers of patients where they didn't, none of these studies did they really measure B12 or folate levels. So I think the last study that you showed was really demonstrating that the only benefit that's really been shown in B12 folate supplementation are in populations where there's no fortification of folate in the diet. And it only pertains to stroke, not to other cardiovascular disease.
Did any of the studies that you look at specify things? Did any of the studies that you look at specify that the participants had to be on certain diets? Like, would the popularity of active diets or ketogenic diets, would these numbers be different?
Actually, no. I think I was looking for ones where people were like, had tried like Mediterranean diet, but not diet. They like, a lot of them excluded people who took folic acid supplements for pregnancy, or they took like up to like 0.2 milligrams a day, but not in particular. I think that China one did talk about like interviewing participants on what they typically ate, but nothing really as an exclusion criteria, no.
Yeah, so when you were doing the, looking at the B vitamins, I saw B12, folate, looked at B6. Anything come up about niacin? Because I think this year Nature came up with this, or put in this study saying that there's a proposed model of like inflammation of coronary arteries as a result of like too much niacin, and it's like calling into question whether we are over fortifying foods with niacin. I was just wondering if you came across that.
Yeah, I actually think in the 2021 study, it might have mentioned it actually going the other way and causing harm, but I don't remember the mechanism of that. I don't think it's recommended to take niacin supplementation by any of the studies that we found. Yeah.
Yeah, I'm not sure in answer to your question whether they've looked at niacin fortification. I'm not sure how much of our diet is fortified with niacin. Cereals, breakfast cereals probably are, but I don't know about other
A lot of
grains.
multigrain breads, I think, if you look at the contents, will indicate that niacin is it's pretty fortified with that. Yeah.
I think that I don't know the answer to your question, but I would imagine that probably the detrimental effect of niacin has more to do with like taking supplements, like actual supplements, rather than just fortified diet. But I don't know.
Yeah.
All right, so it's time to vote. Is it a myth in the general U.S. population, folate and B vitamin supplements decrease cardiovascular risk and mortality, which is something that's still thrown out there, as you saw some popular articles still say that. So how many people think this is true, that folate and B vitamins decrease cardiovascular risk and mortality? How many think it's plausible? Nobody. How many think it's busted? It's pretty unanimous. All right, great.